Hi everyone, my name is Hailey Longe, and today I'll be presenting my evidence-based practice project using case study number 2. In this presentation, I'll go over Sarah's case, explain my PICOT question, discuss the 3 research articles I selected, and then explain how I use that evidence to develop a treatment plan and evaluation of that plan for Sarah. Sarah is a 35-year-old divorced woman who is a primary caregiver for 3 children and her mother, who has Alzheimer's disease. She has major depressive disorder, generalized anxiety disorder, and chronic insomnia. Even though she's taken sertraline and melatonin, she's still struggling with depression, anxiety, poor sleep, and caregiver burnout. Because of her responsibilities, she doesn't have much time to take care of herself, and her symptoms are affecting her daily life. After reviewing her case, I wanted to see if adding cognitive behavioral therapy, also known as CBT, could improve her caregiver burden, depression, anxiety, and insomnia. To help answer that question, I created this PICOT question. My population includes adult family caregivers experiencing anxiety and depression related to caregiver burden. The intervention is cognitive behavioral therapy compared with medication management alone. The outcomes I wanted to measure were caregiver burden, depression, anxiety, and sleep quality over a 12-week period. This question helped guide my search for the best available evidence. The first article I chose was Effective Solutions for Caregivers of Older Adults by McHugh and his colleagues. I selected this article because it was one of the strongest pieces of evidence I found, since it was an umbrella review. It combined findings from several systematic reviews, making it level 1 evidence. One of the biggest things I took away from this article was that CBT consistently reduced caregiver burden and depression while improving caregivers' quality of life. The authors also searched multiple databases, followed a systematic review process, and evaluated the quality of the studies they included. One limitation was that many of the studies focused on caregivers of people with dementia, so the results may not apply to every caregiver population. Overall, I felt the article strongly supported using CBT for Sarah. The second article I chose was Effects of General Change Mechanisms on Outcome in a Telephone-Based Cognitive Behavioral Therapy for Distressed Family Caregivers by Reed and colleagues. This study was a secondary analysis of a randomized controlled trial, making it level 2 evidence. I chose this article because it specifically looked at telephone-based CBT for distressed family caregivers. The study found that CBT reduced caregiver burden and depression, and caregivers who developed a stronger relationship with their therapists had better outcomes. I thought this article was especially important because telephone-based CBT could be a realistic option for Sarah, since she has a busy schedule caring for both her children and her mother. Article 3, Cognitive Behavioral Therapy for Insomnia to Treat Major Depressive Disorder with Comorbid Insomnia by Furukawa and colleagues. This was a systematic review and meta-analysis, so it also provided level 1 evidence. This study focused on cognitive behavioral therapy for insomnia in adults with major depressive disorder. The results show that CBT-I improved both insomnia and depression, whether it was provided in person or digitally. Since insomnia is one of Sarah's biggest concerns, I felt this article supported adding CBT-I to help treatment plan. After reviewing all 3 articles, I found that they all supported using CBT, but each article contributed something different. The first article showed that CBT reduces caregiver burden and depression. The second article showed that telephone-based CBT can be a flexible option for caregivers with busy schedules. The third article showed that CBT-I improves both insomnia and depression. Looking at all 3 studies together, I felt the evidence supported adding CBT to Sarah's treatment plan. Evidence-based practice is about combining research, clinical expertise, and the patient's preferences. Based on the evidence I reviewed, I would recommend adding CBT while continuing Sarah's current medications. Since Sarah has limited time because of her caregiving responsibilities, telehealth CBT may be a better option because it would be easier to fit into her schedule. I also considered Sarah's preferences by recommending a treatment plan that is affordable, realistic, and focused on improving her depression, anxiety, insomnia, and caregiver burden. Based on everything I found, my proposed plan includes referring Sarah to a therapist trained in CBT to help reduce her caregiver burden, depression, and anxiety. I also recommend adding CBTI to improve her sleep. In addition, I would recommend caregiver support groups, stress management, and healthy coping strategies. Sarah would continue taking her current medications while monitoring for effectiveness and any side effects. Since she also has a vitamin D deficiency, I'd coordinate care with her primary care provider to make sure that she is treated as well. Finally, I would continue following up with Sarah regularly and adjust the treatment plan if her symptoms don't improve. To evaluate whether this treatment plan is working, I follow up with Sarah after 12 weeks, considering CBT typically runs for about 12 weeks, give or take, which matches my PICOT question. I would repeat the PHQ-9 and GAD-7 to evaluate her depression and anxiety and compare those results to her baseline scores. I would also reassess her caregiver burden and insomnia, review how she's responding to CBT, CBTI, and her medications, and discuss whether the treatment plan is meeting her goals. If Sarah isn't improving, I'd reassess the plan and consider additional treatment options. These are the references I used to support my presentation. Thank you for your time and have a great day.